Dr. Lexi Hackman, and today I am presenting a patient with very interesting neurological symptoms and some other symptoms going on in his body, and we will discuss what he has going on.
I have tingling and numbness in my feet and lower legs, and it's starting to spread up to my upper body. I have a rapid abnormal heart rate, and I'm having difficulty breathing. Doctor, what's wrong?
That's a good question. What you probably have going on is Guillian-Barre Syndrome. What this syndrome means is that you have an immune disorder, which your immune system is coming in and attacking your nerves. This shows up in the tingling and sensations in your lower extremities, which can also lead to paralysis, but I'll get into that later. There are three types. The main type, which is mostly found in the US, is AIDP. It is the one that is present most likely in you right now. The other types that are present are Miller-Fisher syndrome. This means that you have eye paralysis primarily, and then later moves to the rest of your body. The others are acute motor axonal neuropathy or acute motor sensory axonal neuropathy. These are much more common in Asia and are not very rarely found in the United States. Most of the symptoms do correlate with what you have going on, such as prickling, pins and needle sensations in your fingers, toes, ankles, and wrists, so mostly your extremities. You can also have weakness in your legs that spreads to your upper body as it progresses. You can also have unstable walking or inability to walk or climb stairs, as well as severe nerve pain, lower high blood pressure, and difficulty breathing. The only issue is this condition is fairly new research, and there's not a lot known about it, as in the cause is not known. We have some theories about where it could come from, as in a lot of the times it presents itself after respiratory or digestive issues, and a lot of times it does show up after other infections come into your body, such as flu, Epstein-Barre virus, Zika virus, various types of hepatitis, and surgery, as well as other types of diseases. What this means for your body, I can show you. So, before I can describe neurons that are impacted by Guillain-Barre syndrome, I'm going to describe a normal neuron, what that looks like, so you can compare the two. So, to begin, this is the axon on the neuron. On the outside of the axon, there are myelin sheaths. These myelin sheaths are sleeves of fatty tissue that insulate the axon and the signal that is propagated along the axon to the axon terminal. These are very important as they insulate the axon and can help propagate the signal faster, allowing for faster communication between neurons, which means faster response throughout the body. These myelin sheaths are made up of oligodendrocytes when they're located in the central nervous system, which is the brain and spinal cord, and they're made up of Schwann cells when they're located anywhere else in the body, such as the peripheral nervous system. That is where this disease is mostly focused, as I'll talk about later. So in between these packages of fatty tissue are nodes of Ranvier. The action potential goes through these to jump across the myelin sheaths in order to fully propagate the signal. Other aspects of the myelin sheath are that it properly has to be working functionally in order to insulate the cell and propagate it forward. When these are damaged, that's when the issue comes along, as occurs with Guillain-Barre syndrome. So what happens in Guillain-Barre syndrome is that your immune system mistakes its own cells for invading cells. So what happens is that within the body, you have all these antibodies just waiting for something to come in for it to attack. But what happens is that it mistakes your myelin sheaths for invading cells. So they come in, and along the axon, they come in and degrade the myelin sheath. So instead of looking like this, it looks more like this, as it has been eaten away by these antibodies, which is not good for the propagation and the insulation of the axon. Another way that this can happen is within the immune system, there are also macrophages that can come in and they just take off the myelin sheath. They just strip it off the side of the axon, which again leaves less myelin on the side of the axon, which again does not insulate it as well as it normally should. Other ways that this can happen is in severe cases of Guillain-Barre syndrome, you have what happens is called Wallian degradation, which means degeneration, which means the nerve fibers can come in and they're cut. The rest of the axon is useless. It does not function, it does not propagate action potential, it is done, which means that they are completely useless, the nerve cells are deteriorating, which is not good. What is very unique about Guillain-Barre syndrome, though, is that it usually almost never spreads to the central nervous system. Almost all of this occurs in the peripheral nervous system, which does help for the outlook of the disease. What this means for the rest of your body, though, is that these signals that are trying to be propagated down the axon back up to the brain do not get there. That's why the main symptoms of this disease are numbness, weakness, and tingling throughout your body. And in severe cases can result in paralysis as the signals just don't get to your brain. This occurs on several types of nerve cells. It can occur on the sensory nerve cells, the motor nerve cells, and the autonomic nerve cells, which results in the various types of symptoms that occur and how it occurs in various systems in your body. So, the neurophysiology I just went over causes the symptoms primarily as I described before. When the myelin sheath is damaged and the signals aren't being properly passed through the neuron, it's not getting to another neuron and not getting back up to the brain. So when you're telling your feet to move, the damage of the myelin sheath is causing your brain to not receive these signals, which is why the numbness, tingling, and the paralysis are the main symptoms of Guillian-Barre Syndrome. Another thing that occurs that was presented in the patient is heart rate issues. So what this means is that the type of neuron that it also affects is your autonomic nervous system, which is the part of your nervous system that you cannot control, such as your heart rate and other things occurring in your body that are out of your control. What can happen is that the autonomic nerves are damaged with this syndrome, as in the myelin sheath is damaged through the immune system attacking it. So what typically results in this is a sustained sinus tachycardia, which is medical terminology for an increased heart rate over an extended period of time, which can cause discomfort and other issues going on in the body, just because the myelin sheath for the autonomic nerves controlling the heart rate are damaged. This also can show up in breathing issues, as the motor neurons that control your breathing can be damaged with the immune system attacking the myelin sheath. All of these small things that seem very small, just the myelin sheath degrading, can cause serious issues in your body, and eventually can sometimes result in paralysis throughout the body, which is not pleasant for the patient and normally results in hospitalization. The issue with this disease is that since it is relatively new and not a lot is known about it, there is no current cure for it. On the bright side, most of the time, this disease has resolved itself over a couple of weeks or months, depending on the patient and how severe it is. A good 70% of the patients recover with very little symptoms from recurring. Sometimes the numbness can come back, sometimes mild tingling can come back, and on rare occurrences it can recur in the body, but the majority of patients do come out with positive outlooks. While you still have the disorder, however, there are several things that can help ease the symptoms, though are not cures. One of the main ones is plasma exchange. Plasma is removed and separated from your blood cells, and the blood cells are put back into your body, so the plasma is removed. What happens is the plasma is then regenerated within your blood, and it rids the plasma from certain antibodies that can contribute to the immune system attack on the peripheral nerves, or the cause of the degradation of the myelin sheath. Another thing that can work is immunoglobulin therapy, which the healthy antibodies from blood donors are inserted intravenously into the body. So high doses can help block the damaging antibodies that may contribute to this disease, helping to slow the progression of it. Though those are treatments that work, a lot of times it can be helped with just regular medication. Normally it is working with relieving pain and preventing blood clots in the body, which can occur through this disease and can also end up being primarily damaging to the patient while they are still struggling with it. Guillain-Barre syndrome is a condition that does cause paralysis and a lot of damaging issues to the body, so recovery of this disease is not easy. Though the prognosis of it usually doesn't last longer than a few weeks or a few months, recovering from full paralysis is not easy. It normally does occur in a hospital with lots of physical therapy and requires a lot of emotional support and other medical help to get through this difficult time. Though not much is known about Guillain-Barre syndrome, it is still a very interesting neurological condition. There's a lot to learn about it. There is not very much known about the cause, so extensive research is being done and can continue to be done for what truly causes this devastating neurological and paralyzing disease. If you have any of the symptoms I have described in this video, please go see your doctor immediately. Thank you so much for watching.